Hey guys, third week of February. So glad that we all made it here today. This week and this month, we'll be talking about the immune system. Before I even get into this week's news article, I just want to share some tidbits that I learned from the largest chiropractic seminar in the world that we had in Vegas last weekend. One of the big takeaways was breathing technique. And one of the things, if you could keep it in your head, is no matter what position that you're in, whether it be seated, or squatting down, or doing a plank or a push-up, are you able to breathe at 90% of your maximum volume while you're doing that activity or in that certain position? Something to keep in mind. So whether if you're sitting at the desk and you're sniffing computers and you notice that your chest collapses, there's just no way you're getting 90% oxygen here. So breathing is essential for energy production, right? And this whole rib cage chest area, it should work like a balloon. There should be movement in between each of these ribs. We should be breathing with our belly. And so we did exercises there and got in different positions and tried to find the optimal positions, right? Also breathing at close to normal. So one of the things I'd encourage you guys to try this week, maybe every single day this week, I know we've been doing it in the office for part of our huddles, is actually a breathing drill. And so I would encourage you, if you can, lay flat out on your back, but if not, you're gonna wanna take deep breaths in through your nose, you're gonna expand the belly, expand the chest, get those ribs moving, right? And really get air completely into your lungs, fill them up all the way, and then quickly let it out. So it looks like this. And this is important. So you shouldn't just be using these accessory muscles to breathe, right? These are big belly breaths, and you're gonna do this for 2 whole minutes. At the end of 2 minutes, hold your breath and see how long you can hold it for. This is a great test to see how stressed your body is, if your body's in fight or flight. If you notice that you can barely hold your breath for 10, 15, 20, 30 seconds, you know that you're in stress mode, you're in fight or flight mode. This is when you're more prone to illnesses, to sicknesses, to viruses, to bacteria. This is when you're more prone to injury if you're playing a sport or if you're doing an activity. And so time to rest, time to get back focused, right? Maybe do some additional breathing and then retest, right? So I've found that in times of stress, I'll certainly be under a minute, whereas when I'm calm and relaxed, I'm able to hold my breath for far over a minute. Second thing, when it comes to your immune system, it kind of goes right along with this. It comes with exercise. They did a study, in fact, I encourage you to read this, it'll be up at the front desk, but in the study, they found that the participants who completed regular exercise actually had a stronger immune system where they were getting sick less frequently. This doesn't mean that you have to spend 30 minutes in a gym or an hour in the gym every single day. That's not what it means. We're talking getting the body moving, getting air exchange, raising up your internal temperature, right? And we know that as the internal temperature goes up, we start defeating the bugs, the germs that are around us and on top of us. That's one of the reasons that us personally, we have a infrared sauna at our house. And so we spend 4 to 5 days a week at least 15 minutes each day in the sauna, and that's the entire family. Even my 2-year-old gets in there, right? And so we start sweating, right? This is all before we take our showers in the morning, but it's a great way to kind of get that core temperature up there, get some sweat going, right? Which kind of releases the toxins. Great way, as your temperature goes up, your enzyme and your cytokine activity goes up, which means your immune system is boosted. Highly recommend it. If you don't have a sauna, that may be a great purchase for either the next holiday that comes around. On the back of here, of course, is always our next workshop. So we're gonna go into this deeper at our immune system workshop, 21 days to boost your immune system. So if you've been dragging and suffering, if you maybe you didn't do that challenge with us earlier in January and you wanted to boost that immune system because this is the time of year that your family's sick, everyone's sick in the household, what can I do? Get to the workshop. It's next Wednesday, it's the 19th at 6:15 p.m. The following Monday, the 24th, we're going to be doing yoga, mindfulness yoga. One of our great patients, Patty, will be teaching that. First come, first serve here. Please sign up at the front desk. That's also at 6:15 the following Monday, the 24th. And lastly is our Vital Shift dinner, right? Vital Shift dinner, this is where, again, if you don't know, if you're really still kind of confused on how chiropractic works, or maybe you have just a lot of questions for me, come. I'll feed you dinner, invite a guest, and we'll go over how to get the best results in our office. If you've never been before, it's a must-do. If you have some friends that are curious about what we're doing in this office, this is a great time to invite them and have dinner on me. Lastly, is some of our exercises. And so I want to encourage you guys, one, just to keep up with those basic wobble exercises. I know that Miguel went over those a couple weeks ago with you, but still, every day, twice a day, I want to make sure that I find that this is best accomplished when you put it in a pattern or put it in a habit in your life. And so I do this and I attach it to my brushing my teeth. In the morning when I brush my teeth, very quickly, actually usually before, I do my wobble exercises right at the edge of my bed. And then right before I go to bed at night, I do those wobble exercises, edge of my bed, side to side, front to back. Don't have to have the cushion. I just get that movement in my spine. You know, I've been kind of hunched over patients all day long. It's great. It's like a nice refresher. And then I lay right over my rolls, in my case, my dental rolls at night. Again, I hope this helps. Can't wait to adjust you this week, and have a wonderful week. You know, it's been a strange week where we've had a lot of patients come in with wrist pain. Different types of wrist pain, some numbness and tingling, some where it's kind of radiating to their hand or their thumb, some it's just localized, some it's kind of going up their arm. But the question I want to answer today is, can chiropractic help people with wrist pain? And the simple answer is yes, but it's really through the assessment that I can see what's causing that wrist pain to begin with. One of the patients that had the wrist pain and kind of into his thumb was actually from a motor vehicle accident where he slammed it in like this, and it just kind of really stretched and mashed not only the soft tissue but the 8 tiny little bones that make up your wrist. And so those have all become stuck and not moving properly. Another person was literally actually in the military, unable to lift weights any longer, and this is a young fit guy, unable to work out any longer because of the significant wrist pain he had in here. Again, same thing. When I actually did the assessment, one of the 8 bones in here was absolutely locked up, and every time he brought his hand into extension, it was like excruciating pain. Right? And then the last one is that common, unfortunately, common numbness, tingling into the hands and fingers, kind of starting at the wrist, almost like a carpal tunnel. And that's, again, something that through the assessment we can see, is it here, or through taking a series of neck x-rays, we can a lot of the time see where carpal tunnel, that numbness, tingling in your hands, can actually start in the neck. And so those nerves in the lower part of the neck, they of course travel into the shoulder, down to the arm. If it gets bad enough, if you have subluxation or pinching of these nerves in the neck, and then also you're straining that wrist with improper positioning at your office or at your desk, that can also cause wrist and hand pain. And so I can tell you that those 3 individuals are now doing better as we're getting their bodies working better. Certainly chiropractic doesn't cure anything or heal anybody. That power that's inside your body heals your body. But if we can find out what actually is causing it, rather than just kind of taking the painkillers, doing the steroid shots or whatnot, it's a natural and oftentimes more effective way of helping people with their wrist pain. Again, Dr. Joe Utash, Wellness Key Chiropractic.
Alrighty, I'll be showing you today how to do your wobble exercises. So with the wobble exercises, think about it like brushing your teeth. You brush in the morning, you brush at night. As that is your oral hygiene, this is going to be your spinal hygiene. So spinal hygiene, we're breaking up the scar tissue and also rehydrating those discs. So when you do these exercises, go up to the point of discomfort, don't go into that pain, okay? So we'll start off with the first one, side to side. So you go ear down to your shoulder, and then hip up, kind of like you're forming a letter C. I'll go ahead and go back to the other side. So nice and easy. All together, it ends up looking something just like this. Okay. The next one, you'll go chin down to your chest, roll your shoulders forward, tuck that tailbone in, look up to the ceiling as high as you can, arch your back and pinch your shoulder blades. All together, it ends up looking something just like this. The next one, your hips are going to be stationary. They don't move at all. Arms up shoulder height, and then twist. When you twist, make sure your head does follow. Try to find a point behind you, look at right behind you. So those are the 3 exercises that we will ask you guys to do twice a day at home, okay? So remember, it's like brushing your teeth, but it's for your spine.
Hey guys, Dr. Joe Utash, Wellness Key Chiropractic. A common question we get asked is why do we take x-rays on patients or on people before they become patients and during our exam process? And I'll kind of go over a couple of reasons why that is and throw in some examples, but the big reason is to see is to know and to not see is to guess. I can get a much more specific adjustment. The x-rays aren't just used once in our office. They are actually used every single visit. They'll pop up, and I'm actually able to use those x-rays for adjusting that patient each time. One of the big reasons, and one of the things that I see now more and more frequently, is what's called a spondy, where that spine literally starts shifting or shearing either in the neck or in the low back. And so this could radically alter my adjustment rather than just kind of getting in there and feeling with my hands and adjusting a person. So normally I might adjust a person when they're face down on the table. With this spondy, I certainly wouldn't want to push it any further forward, and so it would actually alter my adjustment. Another example is we actually have several patients that come in here after surgery, after back surgery or neck surgery, and I just need to see where that surgery was performed. So whether it was a fusion or they removed the pedicles or the spinuses, I need to see exactly what I'm dealing with underneath the skin. Sometimes I see a 20-year-old scar and I don't even know what's in there. Sometimes it's almost like we have some skin, some tissue, and a spinal cord there. I'm going to need to avoid that area or certainly approach it differently. And so certainly we see many patients after spinal surgeries, but that's an absolute reason why I'd want to take x-rays first. Now, in addition to taking x-rays, we actually take functional x-rays. And so if the chief complaint is in the neck, I'm going to take an x-ray where you're first looking straight ahead and then from front to back, and then I'll actually have you in motion. Take an x-ray looking down and an x-ray looking up. This way I can see which of the 7 bones in your neck are working and which ones are not, again called subluxation. In the lower back, whether it be a sciatica, a stenosis, a back, a hip pain, maybe just GI issues, I'm going to pay careful attention to the lower spine. So there's 5 vertebrae in the lower spine, then you have your sacrum and your pelvis. And so again, we do a standard weight-bearing x-ray from front to back, also from the side, and then I'll actually take an x-ray of the patient bending from side to side. So this way I can actually see there's some normal biomechanics that should be going on underneath the skin that I wouldn't be able to see unless I took those x-rays. And so this gives me a ton of information to use when it comes to deciding how I can help that patient. So I hope this helps. Why, as a chiropractor, I almost always take x-rays. Dr. Joe Utash, Wellness Key Chiropractic. Thank you.